Neurodiversity refers to having differences in brain functions that are associated with diverse psychological and behavioral patterns. Neurodiverse people experience the world in unique ways that may be very different from the experiences of the majority of people. Neurodiversity is not necessarily an illness or a disorder, but rather many types of neurodiversity can be considered just as alternative ways of brain functions. However, neurodiverse people may go through a lot of challenges in their education, social life, and professional life because a lot of standards of educational and work settings are not consistent with the unique brain functions of these people. The same is the case for their experiences in social life. Many norms and conventions in social life are inconsistent with the unique needs and characteristics of neurodiverse people. Such inconsistencies can result in some mental health problems for neurodiverse people, such as experiencing higher level of stress, difficulties with concentration, problems with auditory processing, and difficulties with social adjustment. The term neurodiverse is as opposed to the term neurotypical. Neurotypicals are the majority of people who are not falling into any category of neurodiversity. In other words, if you do not have a diverse neuropsychological condition such as autism, you are a neurotypical. Neurodiversity can be developed due to genetic factors or the interaction between genetic factors and childhood experiences. However, it is important to note that neurodiversity is not necessarily equal to intellectual disability. Although different types of intellectual disability can be categorized as cases of neurodiversity, many neurodiverse people do not have intellectual disability. A large number of people that you already know are likely to be neurodiverse. Neurodiverse people are a considerable proportion of every society. It is estimated that 15 to 20% of world's population are neurodiverse people. That means 1 in 7 persons. However, neurodiverse people are in the minority, and unfortunately the majority of neurotypicals do not have a proper understanding of the unique needs and challenges of neurodiverse people. As we mentioned earlier, many of the standards of work, education, and social life have been created by neurotypical people, and these standards do not fit the brain functions of many neurodiverse people. This attitude can inhibit neurodiverse people to be included in the society. It can prevent them to follow their intended professional pathways or actualize their talents. However, with increasing awareness, understanding, and appreciation of neurodiversity, we can help these people to actualize their unique strengths and have productive and healthy personal, educational, professional, and social life. These people have unique talents and hidden treasures of love, innovation, and creativity that with the support of neurotypical society can be actualized, and it can benefit significantly the neurotypical society as well. The purpose of this channel is to improve understanding and appreciation of neurodiversity. However, we only will be focused on certain types of neurodiversity. Specifically, we will be focused on increasing awareness about autism and complex trauma, dissociative identity disorder, and borderline personality disorder. We will have a series of podcasts for each relevant topic, and will try to keep each podcast concise but informative. The content of our podcasts is being created based on both research and lived experiences. We strongly value lived experiences, as this is a very important gap in the current mental health research, theory, and practice when it comes to neurodiversity. The creator of this channel, Dr. Forooshani, is a clinical psychologist and professional researcher in the field of psychological trauma with several years of practice as a psychotherapist. In addition to several years of research and practice in the field of neurodiversity, Dr. Forooshani is a high-functioning autistic person and a survivor of complex trauma. The creator of this channel has been connected and working with neurodiverse people for several years, and therefore has developed significant amount of knowledge about lived experiences of people living with conditions such as complex PTSD, dissociative identity disorder, borderline personality disorder, and autism. You can subscribe to this channel if you are interested to be a part of our team and contribute to our purpose to increase awareness and appreciation about neurodiversity. Especially, if you are a neurodiverse person, We greatly appreciate you joining our channel and sharing your own lived experiences with us.